Good day, and welcome to a special edition of Living Well with Adena. My name is Dr. Kataka, and I'll be your host today. Today we're having a special town hall, a COVID-19 update. I don't have to tell all of you here that we're living under a challenging time. The worldwide pandemic still is increasing, causing all of us challenges, increased stress, and worry. You know, we recognize that many in our own communities are testing more positive. The hospital is seeing increased patients and increased severity of disease. So we gathered special panelists today to be able to talk to you about some of those things that you can do to continue to help all of us. We also feel that it's important for us to share with you some important updates that as an Adena health system that we are taking to ensure that we continue to deliver great care. Fortunately, we are not alone, and today I'll introduce to you a guest from one of our community partners as well. It is true that many of us are getting tired, and our caregivers are no exception. But one thing that I can promise you, all of us, each and every member at Adena, is dedicated to ensure that we deliver to each and every one of you out there in our communities the highest quality care with the most compassion possible. I'm honored today to be able to introduce you a few guests. And before I do, we want to remind you that we want to hear from you. So if you have questions, comments, or concerns, please enter them into the available box below. We have staff that are on standby that are going to be prepared to give us those questions and have these panelists answer those for you. So without further ado, let me introduce to you our panelists today. We are honored to have with us Jeff Graham, who serves as the President and CEO of Adena Health System. Welcome, Jeff.
Thank you. Thank you.
With Jeff is Kathy Edrington. She has her doctorate in nursing, and she currently serves as the Chief Operating Officer. Welcome, Kathy.
Thank you.
Off to my right here is Dr. Kirk Tucker, who is an internist at Adena, and he serves as the Chief Quality Officer. Thank you, Dr. Tucker. And to our community partnerships, we also are honored to have with us Dr. Christopher Brown, who is the Medical Director for the Ross County Health District. Thank you for taking time out of your day.
All right, thank you.
So Jeff, let's just dive right in.
Sure.
We've had a similar one of these town halls earlier in the spring when the pandemic first started.
Yeah.
Can you give us an idea of what's changed and how's Adena taking this approach?
Yeah, I mean, probably the big change was, if you remember back in March, we did all the prep work. We have the incident commands, tremendous amount, 24/7 work, week in, week out, ready for the storm to hit the shores. But the storm never really hit South Central and Southern Ohio. But all that preparation that's been going on now for 9 months and continues to happen has really prepared Adena Health and being ready for what we're seeing now. And we are seeing the patients. We are seeing a lot of COVID. As you watch the local TV, you see the counties and how they're lit up. It's here. It's really here. And but I want to assure everyone that all the work that has happened and continues to happen, Adena is a safe place to be. You know, you should not be fearful of seeking treatment. If you have the signs or symptoms, you know, we have the clinics out there. We have, depending on how severe the symptoms are, whether you need to come to the hospital, you should feel very, very safe. But that's the big difference, and we're ready.
Can you just take a moment, Jeff? I know you lead a great health system. Just talk to us a little bit about the caregivers that are working through all of this, and what would you say, and how would you describe them?
True heroes, true warriors, taking on this fight day in and day out. Dr. Tucker, Kathy, and myself, we actually just came from rounding and on some of the nursing units and our COVID units, and you know, the tireless efforts that they give every day, and they're tired. We're all tired, right? Everybody's tired of COVID, everybody's tired of Max, but I got to tell you, the caregivers, the nursing staff, the respiratory staff, the environmental services staff, you never know by watching how they come in every day, and the passion and the compassion they have for the people that are here that we're taking care of. They love their patients, they love their community, and they're not going to give up. They're going to stay with this fight every day, and we're all one team trying to get us to the other side. And as I say, tomorrow's a new day and a new day closer to getting to the other side of this storm. But everyone in the community should be very, very proud of their loved ones that are here working and taking care of our communities in their time of need.
One team in a great fight.
Absolutely.
Dr. Tucker, let's talk about that fight a little bit that Jeff was describing.
Certainly.
Let's review a little bit in this fight. What could the community members that are listening to us now help to, what to do to help the spread and to help to decrease this pandemic?
Well, I think to open up, it's important to convey the difference in what we're dealing with right now in this surge to what we've seen so far in the spring and the summer. You know, I know people think, oh, a third wave. This one is I said it earlier, this is the real deal. If you look at the total number of cases which have occurred in the state of Ohio from the beginning of this whole pandemic since February, a third of them have occurred in the last 2 weeks. The graphs, a third
of them
of the cases have occurred in the last 2 weeks, over 8 months of time. This is the one. This is the one we prepared for. This is the one we tried to staff for and equipment for and collaborate for. It's here. So everybody needs to understand that. If there is to be a fourth wave, I pray to God there isn't, because it'll be catastrophic. And what people need to understand, and I know that the thought is, hey, I've known somebody with COVID. I knew a 70-year-old guy with COVID. He wasn't that sick. He got better. It's not that big of a deal. I know several people who had it and got better. The problem is you can't tell. One person to one person, aged match, same body type, same medical problems. One gets it and has some sniffles for 5 days and recovers. Another one gets it, and I get to see them up on the COVID unit, right? Intubated, and we can't save them. That's what the public doesn't get to see, and I think that's part of the reason people don't understand. So what can you do in the middle of this real deal surge? This is the time. The hurricane's here. Certainly what you've heard over time is washing your hands, at least for 20 seconds at a time, or using approved alcohol-based hand sanitizer. Keeping a safe physical distance of 6 feet or more from people in public, so when you do have to go to the grocery store, not crowding in line with a whole bunch of folks or up at the deli. Wearing a cloth face covering, so you know everybody keeps talking about these masks. It's not political. It's an inconvenience. It bothers my ears. I feel like I can't think right when the thing's on because it feels like it's just in my face. But at best, I think it's an inconvenience. I'm not making a statement. I don't advocate one side or the other, either way. But I'll tell you what, if I'm wrong and the face masks do nothing, at best I get some sore ears. If we're right and these masks actually do reduce the amount of virus you inhale when you walk through a cloud of it, or keep it out of your mouth and nose altogether, boy, wouldn't that be worth it. And you'll never know something that you avoided getting, right? We can't measure that. We can't measure the guy that goes to Walmart, wears his mask, and doesn't die of COVID. You can't measure that. So wear that mask, cover coughs and sneezes, stay home when you're sick. And then the final one, as we approach Thanksgiving next week, is gatherings. And I understand how hard this is for families and how strong those ties are that bind. And they get together a couple times a year and have huge family gatherings and celebrations. Unfortunately, this is not the year to do that. Mine is one of those families that does that. I mean, numerous gatherings. Next Thursday, my wife and I and my 3 kids are going to be at home enjoying a meal, watching some football, and maybe talking to my mother or father on a Zoom call. You don't know when you have this thing. So to bring it into a family gathering and give it to one of those people that is going to be susceptible to dying from it would be a travesty I don't think any of us would ever be able to forgive ourselves for. So please believe me, I'm up here as a physician, as a scientist. I care about people, that's why I do this job, and I'm asking you to do what we need to do to bend this curve, because right now we're in the midst of a catastrophe.
Dr. Tucker, we know that unfortunately some people will continue to get sick. What would you say are some steps that a person should take if they're not feeling well?
Certainly. So if you have any symptoms that for you could suggest you might be infected with this, and generally speaking, that's fevers and chills, feeling like you might have the flu, nausea or lower abdominal cramps, loose bowel movements, cough, shortness of breath, headache, muscle aches and pains, those flu-like muscle aches and pains in your low back. Any of those types or symptoms, you have several options to reach out for help. The first of which is to call 542-SAFE or local area code 740-542-7233. They will ask you some questions and guide you in the right direction so that you can get tested, and if you're sicker than that, where you need to be to get care. Secondly, if you have an Adena primary care physician, you can certainly contact that office. We've set up a lot of telehealth capabilities, so you probably won't even have to come to the doctor. They will interview over the phone, might ask you to take your temperature, ask you about your symptoms, and if need be, order a COVID test for you or other laboratory testing or x-rays that might be warranted. All of our urgent cares now are equipped in a safe place to go to be evaluated for coronavirus. So they can do a nasal swab there, and you should have results from the urgent care within 2 to 4 days of visiting there. And then certainly if you have any emergency signs or symptoms, and that would be chest pain, difficulty breathing, shortness of breath, fevers that won't come down or that are getting worse, 104, etc. Coming to the emergency department, we have a designated pod to care for people presenting with COVID-like symptoms to keep those folks safe and separate from folks coming with other conditions like broken legs or strokes. So it's a very safe place to be. All of those rooms are separated and individualized, so you'll be kept safe while you're there. But those are the options you have for getting care.
So as you heard from Dr. Tucker, there are plenty of options out there. You don't have to go at this alone. And for those of you, as a reminder, the hotline is there for you. Again, it's 542-SAFE, 542-SAFE. That hotline, there will be people on the other end to guide you through that. You heard me mention that we have community partners in this, and I'd like to turn now to you, Dr. Brown, and talk to you. First of all, thank you very much for the work that you're doing with the health district, and we're grateful actually to all of our health district partners throughout our region. We know that there are other counties involved as well. We hear a lot about these alerts, the red, the yellow, the orange. Could you just review that with us again, what these levels mean briefly and how we should respond to those?
Okay. Yes. So the Ohio Department of Health has come up with basically a 4 color-coded alert system that kind of help with supplement the orders that are coming down from ODH and the governor. And the idea about this is that as your colors change, our local area may be more restrictive about activities within that particular county to try to prevent the spread of coronavirus within that area. So there are 4 levels. There was yellow, orange, red, and then purple. Right now, the majority of the counties are in red, kind of like Dr. Tucker said. We do seem to be in that wave that we've been anticipating for quite a while. These levels are based off of 7 different metrics, 7 different pieces of data that include hospitalizations. And so that was one of the reasons why, why a lot of these counties are in the red. And so with that system, we're able to more individualize certain counties in terms of how we do restrictions.
And Dr. Brown, is it true that all of the surrounding counties are currently in a red alert? Is that correct?
Yes, all are in red alert now.
One of the things that we at Adena recognize is the importance to get that alert system out to you folks in the public. So you should be seeing very soon all of our digital billboards that touch all the counties that we serve. We'll send out reminders and we'll actually give you a visualization of what level alert your particular county is in. That will help you also to understand where we're all indeed at. So let's talk a little bit more about the numbers, Dr. Tucker. Can you give us just a little bit update on the regional and state surge numbers and give us some, you mentioned before you like the data. So yeah, tell us a little bit more about those data points.
So the nation as a whole is worse off than Ohio at this point in time. Approximately 1 in 3 of tests being run right now in the United States is coming back positive, if you can believe that. In the state of Ohio, about 1 in 5 tests being run is coming back positive. And this reflects on what many of you probably heard as the test positivity rate. So when we run a whole bunch of tests, what fraction of them are coming back as positive? And this helps to account for the fact of volumes and testing up and down. So I hear a lot of people say, yeah, we're doing more testing. Of course we're picking up on more cases. Well, when that test positivity rate is shifting, even though the number of tests is growing, that tells you that the virus is more prevalent. Another undeniable factor is hospitalizations. So if you're doing more testing, that should not necessarily mean that more people are getting sick enough to be hospitalized. And right now we're seeing hospitalizations in the state of Ohio at an unprecedented level. And that's the part that everybody really needs to understand is the big threat associated with this virus being present. This is a bit speculative, but if you all remember back in the springtime when the northeastern part of the country had their massive surge and we were watching what was happening in Manhattan on TV, the very likely reason for the death rate associated with that surge, which is quite high, was the likely fact that the healthcare systems in that state became overwhelmed. What starts to happen when the number of people being admitted to the hospital is that high is doctors and nurses start to get stretched thin. You get less monitoring, you get less personal attention, you get less of the doctor's thought on your condition. The result of that is people getting sicker than they otherwise would be if we were operating under normal volumes. So everybody needs to understand that where we're at right now today in the state of Ohio, Columbus and the Southern Ohio region, we have more than twice as many people hospitalized as we did during the peak in April.
Twice as many. Is that
twice as many. So they reached near 400 there, and that's talking about huge health systems, Mount Carmel, Ohio State, Ohio Health. These are massive health systems. At that point in time, we reached 400, and we were all working on how we were going to collaborate. They opened the Columbus Convention Center to handle the further surge. As of yesterday morning, we were over 800 patients hospitalized in that same region. So the danger lies in the fact that if we don't bend the curve of this spread and slow it down by wearing our masks and not gathering and washing our hands, it's a realistic possibility you could show up or a family member could show up to a hospital somewhere and not be able to receive the highest quality of care that they deserve in that moment of need. Thankfully, here in Ross County, we saw what appeared to be our local big surge about 2 or 3 weeks ago, and it resulted in our local peak census here at the health system of 40 patients. The night that it really came apart, we had 30 patients in the COVID unit. It was full. Nursing leadership, Kathy, got together and operationalized another 10 beds to be ready for patients that night.
Quickly? You were able to move that quickly to get that set
we opened up 10 more beds, found nursing. Within 12 hours, we'd filled those 10 beds. So we recognized right then the dire situation that we were in. Today, we're down to a lower, more manageable number, which I think I'll hit on briefly. But nonetheless, if things don't change, what we're due for regionally and in Columbus and the state and the nation is not going to be pleasant.
Thank you, Dr. Tucker. You know, we've heard Dr. Tucker talk a lot about the data and the tests, and I know there might be some of you out there in our viewing audience that might have concerns about what happens when a test comes back positive. Dr. Brown, can you tell our viewers a little bit what the role of the health department in a positive test, and what could a patient expect should they test positive?
Okay, thank you for that question. And that's a really good one too, because you know, one thing that we're finding in the health department is that a lot of people, whenever they get these tests, don't understand what happens afterwards. So with coronavirus, this is what we call a reportable disease. So when that test turns positive, it is reported to the health department. So wherever you happen to live, so say that you go up to Columbus, you're a Ross County resident, you go to Columbus, you take a test and it comes back positive. They have a system that they put it into where the Ross County Health District will receive that positive test. Now, whenever they get that positive test, the health department will contact you and you will be asked to voluntarily isolate. And what isolate, and I'll go ahead and talk about a little bit about isolation versus quarantine, because I know a lot of people hear those two words. So when we ask someone to isolate, this is someone that has been diagnosed with a disease, in this particular case, COVID-19, and we're asking that person to stay away from other people because they have the disease, we know it's contagious, we want them to isolate themselves. Now, anyone that has not been diagnosed with it, but has been in close contact with that individual, will go through what we call a quarantine, which is where you're also staying away, but we're watching you to see if you develop symptoms of coronavirus. So that's the process it goes through. So what the health department will do in addition to contacting you and letting you know that you have the virus is what we call contact tracing. So they will contact that individual and ask them, who have they been around and where have they been for about 2 weeks prior to that test date, in order to reach out to those individuals and let them know that whether or not they have been a close contact and whether or not they need to self-quarantine or watch for symptoms.
Thank you, Dr. Brown. We are getting a question that's coming in from the audience. One of the questions that the audience member has is that they were contacted about 9 days after their exposure. Can you kind of give us an idea of why that might be taking long? Is that average? Why does why does it go down to 2 or 3 days, go back up to 9 days?
Okay.
Help the public understand the process there.
Okay. So part of contact tracing is this, and that is kind of like we said. So when that positive test comes back to the health department has to contact that individual and find out where they've been for the previous 2 weeks and who qualifies for as a contact. And then they have to contact that person and then ask them to quarantine as well. So what happens is, as these numbers rise, those test results come into the health department. And so we have to, and there's only a certain amount of staff. So it takes longer and longer to go through the process of contact tracing. And then we have, like I said, you may call an individual. It may take them a day or two to call back. And then, like I said, and so that process goes on. So as the numbers increase, it takes longer to go through that process of contact tracing. And so sometimes it does take a while. And then the other thing is this, and that is sometimes it takes a long time to get the test back. So, and we've seen this before, like I said, kind of back in the earlier days. Normally it takes about 2 to 3 days to get that test back. But sometimes it may be 7, sometimes we've seen as long as 10 days for a test to come back before that person knows that they're positive, for that test to make it back to the health department in order for the contact tracing process to begin.
Thank you, Dr. Brown. Kathy, I'll ask you this question now. We've heard just from Jeff and also from Dr. Brown from a health district point of view, and of course Dr. Tucker just described how we had this influx of patients. And so you are the chief operating officer. You have a tremendous responsibility for taking care of everyone across the health system. Can you talk to us a little bit about there's something called incident command, and what are the steps that you're taking as the chief operating officer to really kind of rally the troops?
Yeah, so we've kind of had to Dr. Tucker's point, we've been planning for this since the spring. We never saw that big surge. And so, incident command is a pretty well-known thing in healthcare. It's an organized way to pull the different resources together. And so, because we've seen a spike in those numbers, we meet every single day to talk about every day about incident command. And so within that, you have operations, you have the supply chain, you have the human resource component, you have the finance component. We're constantly looking at the operations of what's happening on a daily basis, but we're also looking at the predictive analytics. So Dr. Tucker will give us some of that data, and we're able to say, okay, what do we need to prepare for? What are some of the things we've got to put in place that if next week it gets worse, we're able to pull the trigger? And so an example of how we did that was what he was talking about when we had that large spike and we went to those 40 patients. We had already planned for what is our next move if this happens, and that's why we were able to open 10 beds so quickly.
So if I heard you correctly, you pull these key folks together, you plan, and that allows you to be more nimble more quickly.
Exactly.
Now, from your perspective, and Dr. Tucker mentioned a little bit before that some of the staff might be becoming affected as well. We're all human. Can you tell us a little bit about how the staff at Adena Health are doing, and what are we managing to do to get through it?
Yeah. So, and I think Jeff touched on this too, they're tired, and that's understandable. Like he said, we just came from rounding with them. Their spirits are much better today than they've been, I think. And I think that they are seeing an outpouring of love, not only from the community, but from their other coworkers within the health system. So when you get in a situation like this in incident command, you have to make some operational changes across the health system to say, how do we move things around? One of the things we talked about in the beginning of this is really learning how to live like a hospital within a hospital, so that our patients can continue to come and get safe care at Adena, and we know that patients can come get safe care, but that we can also take care of those patients during this pandemic. So it's just really important for people to understand that our staff, they're tired. I would be lying if I said that they weren't tired. They are. I think you're seeing that across the whole country. But they're really rallying together to figure out how to cover our patients. And we're working with the outside agencies too to help us get the appropriate staffing, especially during the holiday season, so that our caregivers can get some rest.
I know that you've been involved with lots of planning. We're actually coming to you live from the PACCAR Medical Education Center, which was built in part through a lot of generosity from those of you that are listening. Kathy, can you tell our audience a little bit about even what you're doing here in PACCAR? It's a medical education building, but maybe not for long. What are we doing there?
Yeah, we're looking at all kinds of resources. The PACCAR is a great resource for us on the Chillicothe campus. If we would need to overflow our respiratory type patients that are less acute, we could actually open up an overflow here at PACCAR. We've been planning that since the spring. We dismantled it because we thought we were in the clear, and we've reinstituted it. We have not had to see patients over here yet, but again, we're ready to pull that trigger if we need to. In addition, we're looking at all of our other sites. Our urgent cares have been booming. I want to give a huge shout out to our urgent cares because I know they've had a tough go of it with this pandemic, but they've done a fantastic job, as well as our critical access hospitals. You know, that's an opportunity for us as well. And as we do all this planning through incident command, we're looking at all of those different places where we might have to open a relief valve.
Yeah, and we have two critical access hospitals, one located down in Waverly, and the other one is in Greenfield. And so, if I heard you correctly, we're partnering, through the several different counties.
Yep.
And in a few more minutes, Jeff, we'll get to you, and we want to definitely hear about the regional approach with other health systems. But before we do that, Kathy, can you give us a little bit idea? You mentioned you were rounding, and you've been. Give the audience a little bit idea of how our ICU is doing, and do you have, if anyone has any concerns about the level of care they would be getting in the ICU, what would you say to them?
Oh, I would say you've come to the right place if you need ICU care. I've been highly impressed with the care that we're providing. I think that not only are the nurses fantastic, the providers that are working on these patients, and the detail that's gone into the clinical care, from having folks that are experts in airway management, to teams of people who are experts in taking care of these patients, to ICU nurses floating from ICU to our COVID unit and managing all of our ICU patients around the clock. It's nothing short of amazing, and they've done a fantastic job. I
would agree. We have some remarkable caregivers that have been working very, very hard through that. Let's talk a little bit about that cooperation now, Jeff. I know that you serve on the board of the Ohio Hospital Association. Thank you for representing our part of the state so very well. Can you, we do also know that the state of Ohio, the governor, under Governor DeWine, has set up a system for hospitals to cooperate and link together. Tell us a little bit about your role on the board of Ohio Hospital Association, and how the regional approach is really core to making sure that we meet the needs of our communities.
Yeah, sure. So let me start with the Ohio Hospital Association, and we're very fortunate here in the state of Ohio to have such a strong leadership group representing all the Ohio hospitals. And they have been a integral part in really helping us organize, helping us being able to communicate in real time with the governor's office. As you mentioned, being on the board, I've been very fortunate to be in the room with a lot of the conversations early on that, when we were shut down. When you think about the state we're in right now, I can tell you, because of all that communication and hard work that each of the hospitals, and just like Adena Health here in the 9 counties that we take care of, the governor does not want to shut us down. He trusts us, and he knows that this is what we do best. In the beginning, the real reason for shutting down was due to the fact of PPE, protective equipment. We're in a different place. But to Kathy's comment about staffing, staffing is the real concern, not only for Adena Health, but across the country. And this virus, with the positivity rate and the quarantine, people can't work. So taking it a step further with the region, you'd ask about the region and what we do. Mm-hmm. So being a member of the OHA board, we also in the state of Ohio broke out into different regions. So this part of Ohio is Region 7. And we were asked to lead Region 7 in setting up an incident command. Actually back, if you remember me talking back in the springtime, a lot of the things that we set up for our incident command that Kathy and her team and others were looked at as best practices. So we took those best practices and we shared them with the region. So what does that mean? I can tell you today, and we've been doing this for months, I can tell you today where every COVID patient is in South Central Ohio in our hospitals.
Really?
Yes. I can tell you how many face masks every hospital has. I can tell you how many patients are on the ventilators. It has really developed a very strong relationship that, not that we weren't all friends in the past, but we just never had a need to really converse the way we are today. And those organizations are tight, so your directors of lab, your directors of imaging, your directors of inpatient, our chief nursing officers, our chief clinical officers are talking. Everybody's talking to each other. And so we're sharing best practices, resources. Holzer's been a great partner for us. If they're not getting hit with the surge like we are, they're helping us out. There was a time when Dr. Tucker and Kathy were talking about the most recent surge. We said we need help. Mm-hmm. And we called the CEO and their chief nursing officer and said, can you help? And they said, absolutely. But that's what this Region 7 is all about. It's about taking care of all of our communities, not just the people in Ross County, not the people in Pike County, but all the counties around us, and working together one team. And I'm really happy to say, I'm very proud that this region is really helping lead the way across the state.
That's awesome, Jeff. And if I remember correctly, in Region 7, we have several hospitals. You mentioned Holzer was one of them.
Yes.
Can you tell us who the other hospital partners are in this region?
Absolutely. Of course, we have 3 of the hospitals. Our Chillicothe campus here,
okay.
Our Greenfield, Adena Greenfield, Adena Pike in Waverly, Southern Ohio Medical Center in Portsmouth, and then also Fayette County Memorial Hospital. So we've got about 8 hospitals that are in Region 7.
Isn't that interesting, Jeff? Because I thought they were competitors.
Yeah, we are. We still are, right?
But you're coming together for a common good and a common cause.
It's kind of like our mission, right? We're called to serve our communities, and we take that very seriously. And it doesn't really matter if I wear a Holzer badge or a Southern Ohio Medical badge or a Fayette badge or an Adena badge. That's what we're here to do. That's what we're called to do, and I'm very proud of the way we're doing it. We're taking great care of our people.
Thank you for leading us, and thank you for leading Region 7, Jeff. Very much appreciated. Kathy, Jeff mentioned a little bit about PPE.
Yeah.
And in the beginning, when we first started this, PPE was short, and he alluded that there are other stressors now. But to reassure our viewers here, where are we with the PPE?
We're in really good position with PPE. Again, I feel like we had several months because we didn't see a big surge to accumulate PPE. So when it comes to PPE, that's just not really, Dr. Tucker, I don't know if you have opinion on that, but I think we're in good position. Truly, it's the staffing. And again, I think that's what you're seeing mostly across the country. And and it's not because health systems necessarily don't have enough staff to start with, it's because healthcare providers are falling ill from COVID. And so when you have periods of time where you're having to have people be off from work, it causes a huge strain when you see these high fluctuations in the numbers.
So even more reason than Kathy for us to follow the recommendations that Dr. Tucker reviewed earlier: hand washing, wearing the mask, staying 6 feet apart, limiting our interactions temporarily.
100%.
Yeah. Thank you, Kathy. Dr. Brown, we do have a question that's coming in again. You're very popular for the questions. Is it normal to, one of the viewers asked, is it normal not to know where you got COVID and who you come in contact with that gave it to you?
Oh, yes. So I think one of the things about COVID is that, remembering that this is a virus that we call coronavirus, which is basically, it's a super cold. And if you think about the last time you had a cold and trying to remember where you got that from. So this is one of the reasons we, for the such stringent orders, especially in the beginning and even going on now, is because this virus is even more contagious than the regular cold. And so we have to put forth these public health measures, such as wearing the mask and keeping our distance. And one of the reasons why we want to prevent gatherings, because this virus is highly contagious and it travels. And a lot of times people don't think about, when you go in, so if you go into a crowded room, like who you stood beside, whether or not that person coughed, how long you were standing there, what did you touch? When you touched it, did you touch your face? And so, yes, so it is easy for, especially under normal circumstances, for a person not to know, where they got a particular virus, and especially now. So, yeah, so some people can contract the virus and not know exactly where they got it from. Yeah.
Thank you also for joining us from a health district perspective and doing lots of planning. I'm sure you and your team are doing lots of planning as well. Can you tell us a little bit about what you are doing for that planning, and what are the efforts that you and your teams are undertaking?
All right, thank you for the question. So yeah, so the role of the public health, of the health department in this is, of course, number one, enforcing a lot of the public health orders that are coming down from federal to state and then state to the local areas. So whenever these orders come out, we help, like, so if it's a restriction on a business, we help that business to understand and interpret some of those orders. When there's a mask mandate, we help educate the residents about, number one, why we're doing this, and then also giving instructions in terms of how to do that properly. In addition to that, we also do things like we of course monitor. So if you go to the Ross County Health District website, there'll be there'll be regular updates about how many cases are in this particular county. And in this case, like I said, we actually have individuals, as kind of like I said before, as those cases come in, they're reviewing those cases, confirming this, and then, like I said, we update our website to make sure that that data is accurate. In addition to this, there's also, we also partner with various people in the community, of course, such as Adena, as we're doing here, but also on a county and city level, yet again, to discuss ways of how to better inform the public and educate the public about the nature of this particular virus. Also to educate them about the different laws as they change, because especially in the beginning, a lot of those rules would change very rapidly. And so
there are lots of changes. I think there will continue to be changes.
And they will continue to change. And so as those changes go forth, especially since this is unprecedented, a lot of times people get confused. And so it's our job to kind of go out. We have stakeholder meetings, either with whether it's schools, churches, businesses, to try and help everyone to understand how these rules affect them and how they can protect, whether it's the businesses trying to protect their customers, as well as the people that are working for them, the schools trying to protect both teachers as well as the students. So that's a lot of the stuff that we do at the health district.
Thank you. Thank you for all of your hard work. It's certainly, and to all of your other partners as well. We know we have many health districts across the state that are working tirelessly like you have. Dr. Tucker, we have another question coming in, and this one's for you.
Sure.
The question is from a viewer: should they get checked for the virus if they're going to be coming into the hospital or perhaps going to a family outing? What would be your suggestion there? And they're not having symptoms.
So when you come to the hospital, if you're coming as a visitor, generally we don't recommend testing for asymptomatic visitors to the hospital. If you suspect it by any symptom that you might have it, you certainly are going to want to remain away from the hospital until you can get evaluated properly. I've heard a lot about families planning on going out and everybody getting tested before they come to a family gathering. The interesting part of that strategy is the way that a virus works. So remember, when you first get it, you inhale generally a certain number of virus particles. And once they land inside your nose, mouth, and upper throat, they begin replicating. And it's a doubling process, right? So they go from 5 to 10 to, there on up. It's an exponential growth. So the problem with getting a test in order to prepare yourself for a family gathering is the test only tells you that at that day, the viral level in the front of your nose and back of your throat is not at a detectable level based upon that machine, the test you got. So yes, you could have gotten an exposure to coronavirus, didn't know it, went out and had a test to get ready for your Thanksgiving holiday. Test is negative, but then the next day or the next day as you get closer to that holiday, that test can convert and you be infectious. So it's not a foolproof strategy. So the idea of testing without symptoms to think that you're safe to be around people doesn't hold as much water as some people think it does.
All right. Thank you for answering the viewer's question, Dr. Tucker. As always, the time goes quickly when we're discussing, and all of you have given us great information. Jeff, as the most senior leader in our region that's helping to manage and deliver health care to so many needy people, I'm going to leave you with the last words. What would you like our viewing audience to hear in our last minute together?
Yeah, I've been, reflecting over this long incident command, if you will, longest any of us have ever had to do. And I remember, receiving requests from the community. What can we do to help? We appreciate the overwhelming support that we've gotten from the community and prayers, the mask drives, giving us masks, and donations to our foundation for caregivers. And if you said, what can you do? What you can do to help our caregivers and to help our loved ones is put a mask on. And Dr. Tucker said it earlier, I don't like wearing a mask. I like seeing people's expressions. I like to hug people. I'm a people person. But wear a mask, because by doing so, you're slowing the spread, but you also are maybe keeping one of the healthcare professionals working. Because if the healthcare professional is not here, to Dr. Tucker's example earlier, you might not get the care in a timely manner you need, or it continues to overwhelm all the health system. And it's not just here, it's everywhere. So my one ask is, wash your hands, wear a mask. We'll get through this. It is a real, it's a pain. I'm tired of it. We all have our moments. We've all seen people's behaviors that we never dreamed that we would see. But we'll get through this to the other side, and we'll get through it quicker and safer if we all just go, okay, we're going to beat this thing, and we're going to fight it, and we're going to win, and we're going to do the right thing to keep everybody safe. So that's what I would ask.
Thank you, Jeff.
Yeah.
We will win.
Yes, we
Thank
will.
you so much.
Yes, we will.
Grateful to our guests today. Dr. Edrington, thank you very much. Dr. Tucker, Dr. Brown, again, thank you for our community partners, and then Jeff as well. You've heard some wonderful advice. I won't belabor the point. We are grateful to each and every one of you who have joined us today. Thank you so much. Please be safe and careful. Join us again in 2 weeks on December 3rd, where we'll have another edition of Living Well with Adena and give you further updates on COVID-19 and our efforts to help you and your family and your loved ones stay safe and healthy. Thank you so much.